What happens when the patient tubing or breathing bag is incorrectly connected to an anesthesia machine? And what does the ISO 8601-213 standard have to do with it? An anesthesia machine has 3 different connections. One for the inspiration hose, one for the breathing bag, and one for the expiration hose. There are matching patient hose systems that are connected according to the ports. If the hoses are connected correctly, patients can be ventilated safely during surgery. However, there are also different combinations of connecting the hoses incorrectly. In the first faulty variant, the breathing bag is connected to the inspiration port of the anesthesia machine, and the inspiration hose is connected to the port of the breathing bag. With this configuration, the patient is neither supplied with oxygen nor is ventilation possible. In the second faulty variant, the breathing bag is connected to the expiratory port of the anesthesia machine, and the expiratory hose is connected to the port of the breathing bag. Again, with this configuration, the patient is neither supplied with oxygen nor is ventilation possible. In addition, there is a risk of barotrauma. In the third faulty variant, the inspiratory and expiratory ports on the anesthesia machine are connected with one hose and the 2 connections of the Y-piece with another hose, which creates 2 independent circuits. This misconnection also may not be immediately visible if the hoses are intertwined. There is no connection between the anesthesia machine and the Y-piece or patient. Thus, the patient is neither supplied with oxygen nor is ventilation possible. ISO 8601-213 specifies the requirements regarding hose connections and thus increases design safety so that incorrect connection of the hoses is made considerably more difficult. First, the connection of the breathing bag changes. The breathing bag port on the anesthesia machine is now female, while the hose side connection is male. The hose of the breathing bag is plugged into the breathing bag port of the anesthesia machine. This prevents accidentally attaching the breathing bag hose onto the male inspiration or expiration ports of the anesthesia machine. Second, for use on an anesthesia machine, disposable patient hose systems that cannot be disconnected at the Y-piece are required. This prevents accidental short-circuiting between the inspiratory and expiratory ports of the anesthesia machine. The same applies to coaxial hose systems, as inspiratory and expiratory hoses are not removable. In order to detect faulty combinations of the hose systems and several other potential errors before connecting a patient, various professional societies recommend carrying out simple tests prior to each patient connection. There are several publications available, including the German Society for Anesthesiology and Intensive Care Medicine and the European Patient Safety Foundation. These functional tests must be carried out prior to each patient, regardless of the changes in the standards.